Life is precious. In medical terms, a beating heart, pumping blood is a sign of being alive. But when this beating heart stops, it can render you into a cardiac emergency. A medical emergency may occur at any time with anyone. Therefore, it's important to be prepared. As per the World Health Organization census statistics, mortality due to cardiac causes has overtaken mortality caused by all cancers put together. In recent times, in fact, the reports of heart diseases in a younger age, especially in people who are in their 30s and 40s, is quite concerning. Now, the biggest reason for heart-related deaths is a lack of awareness as to what needs to be done in a cardiac emergency. Every adult should know what conditions qualify as heart-related or medical emergencies. The best one can do is to learn beforehand as to what actions are to be taken in case of a cardiac emergency. Life-saving techniques such as CPR empower you to save a life. It has been proven that bystander CPR improves the rate of survival by almost a staggering 50%. If you have a loved one who has a history of cardiac disease, it's most important that you learn CPR. Research reports that the majority of cardiac arrests occur at home, and CPR knowledge will therefore equip you with the skill and the confidence needed to transform yourself from being a clueless bystander into an empowered lifesaver. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac emergencies so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Today we have with us eminent cardiologists who can help you understand sudden cardiac death as well as the role of CPR to revive and save a life. Joining us on the broadcast this afternoon, Dr. Manish Juneja, Interventional Cardiologist, Director of Rhythm, Heart and Critical Care from Nagpur. We also have with us Dr. Yusuf A. Kumble, Consultant and Chief Interventional Cardiologist, as well as the Managing Director of Indiana Hospital and Heart Institute from Mangalore. We also have with us Dr. Praneeth Polamuri, Senior Consultant Interventional Cardiology from KIMS Hospital in Secunderabad. Thank you so much, doctors, for joining us on NDTV. Dr. Manish Juneja, now people believe if they have had high blood pressure, cholesterol or other risk factors for heart disease, they would know it. Can these conditions appear without prior symptoms?
Yeah, talking about heart disease, hypertension and cholesterol are the most important risk factors for developing a heart disease in future. High blood cholesterol generally is asymptomatic unless and until it is blown out of proportions. And in our clinical practice, we have seen patients even with very high cholesterol being asymptomatic. So a blood test is the only way to diagnose a high blood cholesterol. And it is important for you to know your blood cholesterol levels, because if you don't know it, you might land up having a massive heart attack or a stroke or any other clinical complications. As far as the hypertension is concerned, high blood pressure is also asymptomatic unless and until it reaches a dangerously high level, and it can lead to blockage in your coronary arteries, which can in turn lead to a heart attack or a stroke or any other clinical complications. So my advice is to you to get your blood pressure and cholesterol checked regularly, starting the age of 40 years, every yearly at least. And patients who have a clinical history or a past history or a family history of heart diseases can get it checked even earlier.
Right. So high cholesterol has no symptoms. Therefore, it's imperative that a blood test is done. It's the only way to detect if you have high cholesterol. I'd like to take my next question to Dr. Praneeth Polamuri. Doctor, heart disease can negatively impact people's health well before it's diagnosed. At what age should one start getting heart-related screening tests, and which screening tests should be done?
Yeah, so as you mentioned, heart diseases are the leading cause of death worldwide, and the most important risk factor for patients to develop heart diseases is age. So as a person ages, so is the risk of developing these heart diseases increases. So it is generally recommended for men more than 40 years and women above 50 years to get their heart diseases to be checked. These numbers are not foolproof. For somebody who has risk factors like family history of any heart diseases, somebody who has a history of sudden cardiac death in family, or who are having long history of diabetes, hypertension or excess cholesterol, they also do have a risk of developing these heart diseases. And some women who have pre-menopause or early menopause, they are also at risk of developing these heart diseases. So it is better for these patients to get their heart checked. You can start with the basic investigations like an ECG and echo, which most of the times they tell you about your heart diseases. Sometimes, depending on the risk of the patient, we order for special investigations like a treadmill test, a stress echo, or sometimes even doing an coronary angiogram. Given patient, the risk profile is to be determined, and so will be the investigation that will be following up.
Right, so those having a family history of heart disease and stroke or sudden cardiac death should essentially undergo heart checkups regularly. Dr. Yusufe Kumble, now when we talk about heart damage or heart disease, it can be of various types and because of various reasons. A defect in the heart valve can also cause heart failure. Are all heart valve problems congenital?
Not at all. Actually, valve problems are due to various causes. One of the commonest cause in India is rheumatic heart disease, rheumatic valvular disease it is called. The reason for that is the rheumatic infection during the childhood. And it is, of course, congenital valvular disease also not uncommon. That can present at birth to various age of childhood. And another important cause for the valvular heart disease, the degenerative cause. When when patient becomes aged, the valve will become more and more degeneration and more calcium deposition in the valve. That can cause the valve failure and it can lead to congestive heart failure. And in another cause is they come in the adult reason, ischemic heart disease, which can lead to cardiomyopathies and mitral valve leakage, that is mitral regurgitation. That is also one of the form of valvular heart disease. So it can be from the neonate to late adulthood, and the cause, though it is commonly rheumatic valvular heart disease, it can be degenerative, it can be congenital, and it can be acquired like ischemic heart disease causing mitral valve and other valve leakage also. Right. And all these valvular heart disease can have an impact on heart failure.
Right, so not all heart valve diseases are congenital, but heart valve diseases can also develop over time as you get older or have certain conditions that affect the heart. Now, Dr. Junaina, what are the symptoms of a heart valve not working? What would be the best diagnostic test for heart valve problems?
So as Dr. Yusuf has rightly pointed out, the causes of heart valve disease, it used to be rheumatic earlier, and now more and more degenerative heart valve diseases are coming up as our population is aging and the longevity and the people's life expectancy has prolonged. So it depends on the severity of the disease. A patient with mild valvular disease may not experience any symptom at all, whereas a patient with a moderate valvular disease starts experiencing some difficulty in breathing while walking, while jogging, or any other strenuous activity. So as this severity increases, the difficulty in breathing would increase, and this would then be present at rest. This would actually cause sleep disturbances to the patient, and he may have to at night get up in between to have a normal breathing. The other symptoms which a patient might experience is swelling over the feet and giddiness, faintness, and sometimes you might have a patient with a very severe valvular disease presenting with a cardiac arrest. To diagnose these valvular heart problems, we have a simple an ECG and a 2D echo, which can be done, and it is easily available. It's a cheap test, and it is available in most of the towns nowadays. And these would really help you diagnose these problems early and get the treatment at the earliest.
Right. Dr. Praneeth Polamuri, now Dr. Kumble and Dr. Juneja have already touched upon this, but what are some treatment options for patients with heart valve issues?
So whenever we talk about valve problem, we need to find out what is the particular valve problem and what is the severity of the valve problem. we usually classify these valve problems based on the severity, be it mild, moderate, or severe. Once the valve problem becomes severe, most of the patients do have symptoms, and patients who do not complain symptoms, they are either probably not recognizing or not acknowledging the symptoms. Once the valve problem is severe, it needs to be fixed. Medicines unfortunately can't fix the valve problem, they only offer symptomatic relief. The diseased or the damaged valve needs to be either repaired or replaced. The standard treatment is a valve replacement, which is traditionally done by surgery. However, nowadays we can replace a valve through a catheter. Which treatment is to be done will be decided by the treating cardiologist based on the surgical risk of the patient and all the clinical condition of the patients. For some valve conditions, balloon interventions can be done, which also provide temporary relief. So for a given patient, we need to first decide the severity of the problem, the existing clinical condition of the patient, and thereby decide the definitive treatment.
Right. Dr. Kumble, what are the most concerning long-term problems with cardiac valve disease? And can heart valve disease cause cardiac arrest?
Yeah, one important aspect of this chronic valvular heart disease is the heart failure. And slowly, and the previous Manish doctor already mentioned that slowly they going into heart failure in the form of dyspnea on exertion, breathlessness, and not able to lie down. So there are different stages of heart failure. So from stage 1 to stage 4, the stage 4 is the last stage where the patient is not able to even little bit also, he cannot move, you will be severely breathless. So the long-term effect of valvular heart disease is most important is heart failure. And before the heart failure develops, it has to be corrected. And other problems like the rhythm disturbances, we call it as atrial fibrillation, and other arrhythmias like supraventricular arrhythmias and other ventricular arrhythmias also can come in the chronic heart failure. And another important aspect of valvular heart disease is the stroke. One of the causes for the stroke is embolic stroke, we call it as. Because of the valvular heart disease, the blood can clot inside the heart chambers, which can embolize and go to the brain, which can have a devastating disease like a stroke. So that very importantly, we have to treat these arrhythmias as well as these blood clotting conditions like any clot or any stroke or any precedence of clot. And also it can end up with other renal failure like cardiorenal disease and end-stage heart disease. That is almost cardiac cirrhosis. You can get liver cirrhosis. These are all the long-term problems of heart failure. Usually, the cardiac arrest is less common in valvular heart disease. However, all end-stage heart disease patients may ultimately die, maybe because of cardiac arrest also.
Right, so it's clear with what Dr. Kumble said that heart valve disease can cause many complications over time, and if not diagnosed and treated promptly, heart valve problems can lead to cardiac arrest as well. It's time for a quick break, but our cardiologists stay on with us to help you understand sudden cardiac death and the role of CPR. As we mentioned, every adult should know what conditions qualify as heart-related or medical emergencies. The best one can do is to learn beforehand as to what actions are to be taken in case of a cardiac emergency. We have with us eminent cardiologists who are here to answer all your queries. I want to take my next question to Dr. Juneja. Doc, is cardiac arrest the same as a heart attack for those who don't know? And what should one do if they witness a cardiac arrest?
No, not at all. They are completely different issues, and there is a lot of confusion, and it's a myth that both are the same thing. A heart attack occurs when there is a blockage in the artery of the heart, which leads to reduced blood supply to the muscles of the heart. And cardiac arrest occurs when the electrical activity of the heart stops. So this qualifies as cardiac arrest. Cardiac arrest is ultimately the mode of death in every disease. And a heart attack can lead to a cardiac arrest, but there are many more reasons for a cardiac arrest, actually. So what should be done when you actually witness a cardiac arrest or on the roadside, when somebody sees a person who is unresponsive, he is not breathing? Please call the emergency number. Please call the ambulance and make that person lie on a flat surface and start doing CPR. And if you are not actually trained on CPR, please call someone else for help. CPRs can save a lot of lives. The CPR which you give on the roadside actually gives the time to the patient to reach the hospital. And according to WHO uh, and many other associations, CPRs can actually save more than 40 to 50% of the lives. So CPR, we emphasize that everyone should learn CPR, and there are a lot of programs nowadays, a lot of training programs for general people at large for training in CPR.
Right, so lots to unpack there, Dr. Juneja. A heart attack occurs when the blood stops flowing to the heart, whereas a cardiac arrest occurs when electrical activity of the heart stops. Now, Dr. Juneja has touched upon the importance of CPR. Dr. Pulamuri, what are the current guidelines for CPR in our country?
So there are no standard Indian guidelines that we have because they are universally the same in principle. So whenever we see a patient unresponsive, so first step is to see the responsiveness of the patient. If you find a person unresponsive, you move the patient to a safer place where the CPR can be performed efficiently. How do we perform CPR? The most important step is to deliver chest compressions. The chest compressions are to be delivered by crossing the hands. So you cross your fingers of one hand to the back of the other, and the force has to be transmitted through the back of the hand or the heel of the hand. And how many compressions to be delivered? 100 compressions per minute are to be delivered. And the most important point to note is enough pressure should be released to allow the chest wall to recoil and ensure that the CPR is effective. So the numbers to note is 100 per minute, and make sure that we are giving enough compression so that about 2 inches of the chest wall is getting compressed, and equally give enough time for the chest wall to recoil, and that is how we are giving an efficient CPR.
Right. As per our discussion, cardiopulmonary resuscitation is a life-saving technique, as it's been made clear. Dr. Yusuf Kumble, now will CPR always save a life?
Not, as Dr. Manish already mentioned, that it is not always save life. Up to 50% of the time we can save a life. What is most important is sometimes it facilitates the patient to transfer to an advanced center where the further care can be given. That is very important. And another important aspect of this ABCD, that is a defibrillator, that is AED. AED, if it is available, I think most of the places it is changing this AED there, especially public places, schools and airports, railway station and all. They have installed this AED. That is a automatic external defibrillator. And if the CPR and AED combined, that the CPR effect can be very high, up to 60 to 70%. But we need people who are trained in doing CPR as well as who are trained in using this aid. I think Government of India should look into this as a school program and training more and more people who are involved in the public service as well as in the public gathering like the theatre, malls, bus stands, auditoriums, railway station, like that. There are more and more people should be trained in this area. I think this can go up to 70%. They can save a life if the CPR is proper CPR, trained people, and use of AED is more rampant in this situation.
Right, so performing CPR can double or triple someone's chances of survival after cardiac arrest. Dr. Juneja, now clogged arteries can lead to a heart attack and stroke as well. Can blood pressure indicate blocked arteries?
Yes, of course. High blood pressure generally indicates blocked artery, but not always. the reverse way is also true. When blood pressure can actually damage the walls of your arteries, that's the inner layer of the artery gets damaged due to high blood pressure. And when this inner layer, which we call the intimal layer, gets damaged, it leads to formation of a wound there, just like a wound on the skin. And the cells of the blood, the fat cells, the macrophages, and many other cells, they start accumulating at that place and leads to formation of a blockage in there. And this leads to reduced blood flow to the myocardium, which is the muscle of the heart. And this in turn rises the blood pressure further. So this becomes a vicious cycle then. The blood pressure causing damaged arteries, and then the damaged arteries leading to reduced blood flow, and then again leading to the rise in blood pressure. So it's very important to get your blood pressures checked regularly and treat them early.
Right. Thank you so much, doctors, for all your advice and answering all our queries. Thank you all for investing your time and watching. Goodbye.